Good morning. My name is Corina Herrera Loera, Public Information Officer with the Emergency Operations Center with the Santa Clara County Public Health. Today we have an amazing guest, Dr. Michael Ybarra, who will be joining us shortly. And before we get to him, I would like to give a brief update as to where our county is at and some of the things that actually changed to date. So with that, I'm going to share my screen and give a brief presentation on what some of those updates are. Okay. Thank you for being. And as we, before we move in there, just join me to take a deep breath and ground ourselves as we just continue to ride this wave. It feels like as this pandemic, we're almost up to that year that we sheltered in place. So let's just take a deep breath as we think about all the things we've been through as a community at the count of 3 and ground ourselves together. 1, 2, 3.
Good morning, everyone. We are having some technical difficulties. Thank you for being patient. We are allowing for Corina's video and audio to resume. But as she mentioned, there are some new changes that are starting as of today. Our county of Santa Clara has now moved into a red tier, which means that several activities are now reopening for indoor services. And we are also discontinuing the mandatory directive on travel. We still recommend that folks who are traveling maintain that quarantine, but it is no longer mandatory. Our county is also aligning with the state on all of our guidance and directives, and this is freeing us up to focus on vaccination processes. We are in tier 1B. All folks in 1B are eligible, as well as 1A. This includes all of our health personnel and all of our essential workers in the other categories. So as I mentioned here on screen now are the activities that are presuming under the state red tier. This is indoor dining at a maximum of 25% capacity or 100 people, whichever is fewer. Retail stores are now expanding their capacity to 50%. Gyms and fitness centers at a maximum of 10% capacity. We now have movie theaters at 25% or 100 people, whichever is fewer. Zoos, museums, and aquariums that now have an indoor capacity. And as I mentioned, these sector and activity-specific local directives are no longer in effect. We are under the state guidance for these, and the mandatory directive on travel is no longer in effect, although, again, we still recommend that people who travel outside the area maintain quarantine. We want to make sure that people understand that we're at a critical point here for our county. If we continue to follow the prevention strategies, we will see things improving. However, if we lower our guard, if we engage in high-risk activities, it is most likely that we will see another surge of cases. So again, those safety preventative measures are to stay outdoors. We know outdoors is safer than indoors, that people continue to wear face covering, including double masking. That's an effective way to prevent the spread of COVID-19. That people stay at least 6 feet. More distance is better from between you and those who do not live in your same home. Avoid crowds. And of course, when it is your turn to get vaccinated, all vaccines in the county are at no cost. And there are several vaccination centers throughout Santa Clara County, including those with and without appointment options. We want to just remind folks that these presentations are as part of our effort to engage the most vulnerable community, and messaging is out to Latinx community, particularly those who've been impacted by COVID-19. As we can see in terms of cases of COVID-19, it's our Latinx population who has been most impacted. And when we look at the vaccination numbers, we are still needing a lot more people in our community to get vaccinated from those who are eligible. For those looking for places to get vaccinated, these are by appointment only in San Jose. We have some at our Valley Health Center on McKee Road, at Emmanuel Baptist Church, and that's on White Road. And then we also have the spaces in Gilroy, the ones that are by appointment only at Gilroy High School. And then we also have those that are walk-ins available. Those are at the Public Health Story Road Hub, at the Mexican Heritage Plaza, at the Gardner Alviso Health Center, and at Eastridge. We also have the Gilroy Senior Center, and that's one where you show up early in the morning, get a bracelet with a time to return that same day for your vaccination. Again, for those who are eligible right now, it's those in Phase 1A, which are all healthcare personnel and long-term care facility residents, and those in Phase 1B, residents who live here in the county, who are 65 or older, and folks who work in the food and agriculture, education, childcare, and emergency services sectors. Again, when you go to the vaccination site, you will have to either bring documentation or simply state that you are eligible under those qualifying factors, and that you will have to sign a document stating that you are in fact eligible to receive the vaccine. And with that, I will again introduce our wonderful guest, and we'll take a 30-second pause right now while we shift our screens and make sure that our host is back shortly. And so, Dr. Michael C. Ybarra, you are well known to folks in our community here in San Jose. Been a community leader for many, many years, and now in your new role as a recent graduate of the doctoral program, using your skills in an expansive way to support our community. Perhaps you can share a little bit about your background, both as a community leader and as a mental health practitioner, before we begin our conversation.
Sure. Good morning, everybody. Thank you for having me. I've been providing, I was born and raised in the east side of San Jose, so still true to my heart. I haven't left the community. I'm still here, and I'm still really being the voice of others that don't have that voice. But a little bit about me. I've been providing mental health and social work services for the last 28 years here in Santa Clara County. I've worked with different nonprofit organizations and programs. I stay local for a lot of my education. So I went to Evergreen Community College, was involved in the Enlace program over there. Graduated from San Jose State University with my bachelor's and my master's degree. My master's degree in social work with an emphasis in mental health and families and children's. And then went back, maybe some time later and got a certificate in the education department at San Jose State for spectrum disorders because with mental health, they don't talk a lot about spectrum disorders. However, there's a lot of individuals currently that are on the spectrum and don't know they're on the spectrum. So I needed to educate myself and know how to help others that had a combination of both mental health and also being on the spectrum, because the spectrum is so diverse, from highly functioning to non-functioning to nonverbal. It's just a huge category to select and choose from, and really knowing how to help the individual with that. And then I decided, for myself, for the community, I needed to continue to invest in myself. And I decided to go out and get my doctorate degree in social work. So I was very fortunate to be one of the individuals selected for the Suzanne Dwork Peck School of Social Work program. And I part of cohort 8, shout out to cohort 8 out there. All of us trying to really make a difference in our communities. And from that, I developed a lot of programs, but seen a lot of gaps in treatment for the community. And one program that's still dear to my heart and still that implementation ready for the county is a program for justice involved women that are primary caregivers, which means they're mothers. And so some stats on that is 4 out of 5 women in custody right now are mothers. And about 80 to 90% of those moms suffer from addiction or mental health. So again, really that combination of providing for those women services once they come back out into the community. So again, that's kind of what I've been up to. But now, I'm that voice for others that don't have a voice. And again, I'm interested to hear other people's stories and really looking at getting the east side of San Jose to be able to be sustainable. Like, I truly believe that we can be a sustainable community given the right resources and given the right individuals put on the forefront. And that includes everybody in the community, especially the individuals in the community, people living here. Like, that is so important. I think people forget about that, is individuals with this lived experience are the ones that are really going to help better our future. And really the future is in our next group of children, those next generations. There's still time to get this moving and get this moving in the right direction. And I see so many people out there doing that. And it's just powerful to see that we still believe in the east side, and we still believe really in San Jose, like, those that are still here that haven't left. So yeah, that's a little bit about my background. But again, 28 years of a lot of programs, working with a lot of individuals. I'm really trying to plant seeds and later seeing those turn into flowers. So again, it's really good to hear those stories that people are being successful out there.
Thank you so much, Dr. Michael Ybarra. And I'm back. As Gina Perez mentioned, did we ground ourselves off the page? I guess I did. So thank you, Maribel, for stepping in. So thank you for introducing yourself. I want to just go straight into, a conversation with you around mental health, and forgive me again, these technical issues. I'm glad we have an amazing team, making this happen. So Quetzal and Maribel, thank you so much for holding it down. So with no further ado, I want to start off with, being that there's so much about vaccines, updates, this pandemic, it's been a year, some of us have lost loved ones, just so much happening. Some of us feel overwhelmed, stressed, fatigued, like, I don't even want to talk about it anymore. I don't want to wear this mask anymore. Our children are stressing out with school, some of us that are parents and work full time, doing that double duty. When should somebody seek professional support?
Well, I think let's define what professional support means, because again, right now, what's really great that the community has is we have a lot of peer providers, and peer providers are individuals with lived experience that are really helping out. But when we talk more about professional experience, one thing that I always ask individuals is try to imagine before the pandemic. Try to imagine a year before this, what you felt like, what you were doing. Were you experiencing fatigue? Were you feeling depressed? Were you feeling anxiety? Were these things happening already? And if the answer to that is yes, then you also have to look at how much more stressed out or how much more anxiety or how much more depression you have during this pandemic. Now, for those of us that did not experience any of those things and now are experiencing it now, this is something that everyone is really experiencing. So these are really natural consequences of having all of our freedoms taken away. And when I say freedoms taken away, this again is not going to work, not having to go to school, not going to our place of worship or church, not being around family. So again, we had to isolate ourselves, which again, when we talk about that piece of isolation, was that something you were already experiencing? So when I ask these questions, I'm looking at what we call like baseline behavior. A baseline behavior means this is how I was the whole time. I've had ups and downs, that's natural. But if you have this baseline where it's continuing to go up with stress and depression, and it can't go down no matter what you're trying to do, I would really think about asking for professional help or seeking help or seeing who else is out there that can really support you around these measures. Because again, that's what you want to look for. You really want to look for what's called a baseline behavior. Everyone has a baseline. And that is, if you were depressed before and you're more depressed now, then obviously your baseline is up, right? Maybe you need the help. The other thing that I look at too during this pandemic is a lot of individuals have looked for ways to calm themselves down, which has led to chain smoking, has led to alcohol use, has led to bad eating habits. So again, all these different things are things of concern, because not only are we talking about health, but now we're also looking at addiction. And so again, you have to also look at from previously. Prior to this, what were your drinking habits like? What was your use of other medications or things that you're using now to keep calm? And we want to look at all these different things to really decide, are you needing some professional support? And again, if the answer is yes, then this is where I would say, no matter what, if you're feeling it, go seek the support and ask for it. There's no shame in asking for help. There's no shame in asking for support. So I just want to put that out there for everyone to really think about.
Thank you. And we'll talk a little bit about, that shame and our community and how that's, the stigma that comes behind it. But before we get to that, I want to also ask, I know that you're a director in one of our programs here in the county, providing co-occurrence services. Can you tell us a little bit about co-occurring and what that means?
For sure. So I was blessed to, one, have a great experience in the county. So prior to this, I was the lead mental health clinician at Elmwood Women's Correctional Facility. And I just want to say shout out to everyone working in custody behavioral health for the amazing work they're doing over there. But again, being the program director, I was able to start a program from the ground up, which was really amazing because I was able to share all my visions and all of my experience and all of my program development to really put together a really great program for men. And when we talk about what co-occurring is the presence of both mental health and addiction happening at the same time. And what used to be called before was dual diagnosis. Dual diagnosis means you had two diagnoses. You had a mental health diagnosis, which might be depression, and at the same time, you might have an addiction diagnosis, which could be alcohol, meth, opioids. But together, they changed that, and what's called now, it's called co-occurring. Co-occurring actually means that these things happen at the same time, which means that you're experiencing depression, and so your depression leads to you using some type of substance to really address the depression, or vice versa. Your use of addiction cannot be uncovered yet with your diagnosis of depression until you're stable off of your use of drugs or alcohol. So again, co-occurring just means that these two things happen at the same time. And really, these are the individuals and clients that I work with in our program.
Thank you so much. And, speaking of stigma in our community and sometimes a shame that comes across, none of us like to be told that we have issues, right? But, I know we all have the things we're working on. And, some of us are dealing with that generational healing, of maybe personally, like I'm not dealing with alcoholism, but my grandmother and grandfather did, right? So it's in my genes. And so technically, I see that I'm working on that on behalf of my DNA, right? The people that I represent. But again, nobody likes to be highlighted as, oh, that's the family with the issues, and so sometimes, our community, that stigma that surrounds itself of like, did you hear they went, to a therapist, and, oh, they sent their child here. There's a lot of stigma around that. And I remember growing up, there's a saying in Spanish, calladita te ves más bonita, quiet, you look prettier. And really, as much as I know that my mother loves me and, they passed on these sayings, sometimes, we to stay quiet, take a deep breath before you speak. And sometimes we need to speak up, right? And ask for that help that we need. And so can you tell us, in your experience, why should somebody not remain silent during, if they feel maybe, they're, when you're talking right now, they feel like, oh, that might be me, or that might be my son, or that might be my niece. Why shouldn't somebody stay quiet? And what would you say to somebody who are having second thoughts around seeking for support, seeking for that professional support, or even outside of their own home?
Right. So, in the Mexican, Latinx community, Chicano community, however you really identify yourself, people of color, we really, and I agree with you, Corina, we have been told or taught to keep secrets, right? We want to show up. It almost reminds me of Facebook, right? Everyone's posting all these beautiful things and lovely things. However, is that really what's happening in your life? And to respond to that is, we all have our ups and downs. It's not rainbows and roses every day. You know what I mean? And again, I want people to be clear and understand that we do need to seek that help. If we're trying to find the best versions of ourselves, not only for ourselves, but our kids, there was a quote out there that says, our kids are watching us grow up as parents. And it's so true, because what our kids watch us do is try to be better parents, is try to be better individuals. And again, the shaming part of these stigmas continue to haunt our communities. Just imagine if everybody in our community said, you know what, I'm tired of not being the best version of myself. I want help. Imagine how much our community would strive and be better because they're getting better for themselves. Just imagine what that would feel like. But again, not enough people do that because of the stigmas that you share, which are related to, oh, you're going to be the family that no one's going to talk to. Oh, you got the crazy person in your family. Oh, you have that person over there. Everybody has experienced mental health in their life, whether they believe it or not. And that is a true statement. Everyone has felt anxiety. Everyone has felt depressed or sad. All these conditions and feelings are really part of mental health, but the big stigma is that word mental health. And that's why I've changed it, really using mental wellness, because again, you want to be a complete package. It's not only your mind you have to take care of, but it's also your body. These things all connect together. So again, when you are looking to find the best version of yourself, when you know that you need help, when you're ready to seek that, you shouldn't have to pause and think about what other people are going to think about you. Because again, those individuals are living their lives already. You have to live your life to the fullest. And so I support anybody that's really trying to get the help. Now, again, and I'm going to share this with you, is, the program I work with, many of these men I work with are coming straight from jail and prison systems. None of them have ever been taught how to share their feelings. None of them have ever been taught to how to ask for help or support. And again, this is something that has to be taught and not shamed. In our groups that we have together, I make sure that everybody comes non-judgmental. And that's the thing, is we as a community and a society, especially San Jose, and especially the East Side, we have to stop shaming people and really supporting each other to be the better versions of themselves, to get better, and to seek that help no matter what. Because again, we're really doing it for ourselves. We're really trying to change these generational things that are happening in our families. And one of the things that, was really important, Corina, that you brought up is, when your abuelita said these different things, in your family, make a genogram. I tell everybody this. Make a genogram of both sides of your family and look historically at the alcoholism, at the addiction. But again, look at all the positive things that happen too. Make a list of these things that you're trying to change for your family. And how to better that is call it what it is. There's no shame in saying, hey, guess what? I had an alcoholic father, or I had an alcoholic mother, right? But you can change the rest of the future. The past is part of you regardless, but the future, you can own it and you can change it. But again, sometimes you just can't change it by yourself.
I love that. And, as you know, my husband and I practice a lot of, indigenous, spiritual healing. And I really like that because it's very healing, right? So as I look at that, when I do I know this, but I haven't written it down. So I look forward to doing that, because as we do that, we heal also their generation, even though they're in the spirit world, it's healing, right? It's like weaving. And so I love that. Thank you for bringing that up. I want to take it to our children. As many of us know, our children have been dealing with social distance learning at home in front of a computer for hours, and then they have to do homework, for other hours. And I was talking to one of my friends about, those children who are in the middle school and high school levels, right? They have 4 or 5 teachers, sometimes up to 7. And really, it's almost like sometimes having 4 or 5 or 7 supervisors, right? All doing and assigning their own work, not really knowing what the others are assigning, and they're all due, right? And so I can't imagine being that age, because I know as an adult, I could say, you know what, I need a break. I'm going to leave and I'm going to go walk around, and come back. But my 12-year-old cannot do that, right? She can't just be like, I'm going to go take a break and I'll be back. I'll be like, get your butt back in here. But, as parents, I think it's important to acknowledge some of these things, because I think, we're trying to work, and we know that they have to go to school and make sure they're logged in and do your homework and, come do chores. And so we don't really, some of us haven't really taken account of all that our children are going through. And not just that, but that their brain, is not fully developed like us as adults. So can you tell us a little bit in children, what are some signs, symptoms that we should look out for, that could tell us maybe that they might need support, extra support, whether it's from a family member and or maybe even professional?
Definitely. So with our children, one of the things that we have to look at as well is, social media for a lot of parents are raising our kids. And we have to really look at that as a resource. Too many children are following social media influencers. And the problem with that is they're being influenced without you even knowing it. And so again, their influences might look a little bit different for a lot of folks, but one of the things as parents we need to do is find out why that is so influencing to our children. We also have to take the opportunity to, again, measure what this looked like pre-pandemic. How are your children? Again, remember, our kids have been isolated, with the computer, staring at the screen. So again, they are probably in a mode of depression. And remember, depression also looks like anger. Anger looks like fighting all the time. So again, just because somebody is angry and fighting doesn't mean they have an anger issue. They might have a depression issue. Remember, depression looks like different things for different individuals. So again, you as the parent are really that professional to know, how is my child doing? Have I seen these behaviors change over time? Or is this, and again, this is where we get confused, or we say this all the time is, well, my child's just growing up. Oh, this is the teen years, or these are these years. The biggest mistake we can make is think that everything is okay and not say anything, when again, we should be checking in with our kids, even if we think they're doing good. And I think that's the mistake we make as parents a lot of times is, oh yeah, that individual, my daughter or my son, oh, straight A's, there's no problem. Everything is great. Actually, we don't know everything's great. Just because someone's getting good grades or someone's doing good in school doesn't mean the rest of their life is going good. And again, we also want to know for our kids, how we check in is, who are their friends? Who are their friends online? Who are their groups or supports what they're doing online? These are things that we want to be aware of as well. But again, our children also look for ways to they look for ways to also use some of the drugs and alcohol that we use. And again, I'm talking about our teens. Again, if you have a liquor cabinet, are you making sure your liquor cabinet is still, the same? But again, as we're talking about kids, we have to also measure, again, how was our child pre-pandemic? And that's the thing that I'm stressing to everybody, because again, during this pandemic, many people are depressed. Many people are anxious. Many people are feeling in certain ways. And that's because of the pandemic. That's certainly because we're not in school. That's certainly because we haven't gotten into our groups. We haven't had any friendships. We haven't had any close contacts. So again, when we start looking at do our kids need help? How do we measure if our kids are okay? Again, you have to look at their behaviors and these patterns. And every child is going to be different. So I can't really share like a blanket statement for all children. But again, you as parents know your children. And so I would take the more individualized approach when we talk about our children.
Okay, thank you. And is there any, I'm assuming a lot of it is the same for adults. Is there any particular signs that you would say that maybe would be different for an adult? Male, female, father, mother?
Yeah, no, I think with adults, we have a better opportunity to communicate. We still have that mentality to conversate or to share. I think with our children, their sharing is over text or messages. And so their voice sometimes isn't heard. So it's a different type of conversation, the way our children today are having influences versus adults who actually can sometimes have a better conversation, or you can hear this. And again, a lot of times too, our children just mask things up because they want to please their parents. Everything's fine, mom, dad, everything's going good. Again, it's those blanket statements. Those are the ones I'd be worried about. Tell me what's fine about today. Tell me what's great about today versus yesterday. And again, you have to have those crucial conversations with your children. Don't let time pass to have these conversations. Make it a point every day to pick a time and really have that opportunity to turn off your phones so that it's really that engagement one-to-one. And again, even if you don't say nothing, it's okay. Just being in the presence of another individual, or especially your child, and it could be just quiet time. But again, you're in that presence. So if something does come up, you are available for them.
Thank you. And I just want to remind our community who are joining us here today, thank you for joining us again. Please remember that you can put questions on the comments regarding wellness today. We are here talking to Dr. Michael Ybarra about wellness. And that looks, different for all of us, right? And with that, Michael, what are some things that you would say can help, right? Like I know I've been talking about seeking professional help, but before we get to seeking professional help, what things can help us or somebody feel better?
Yeah. I think a lot of time we have to find that one individual group of folks that are just able to listen. I think a lot of times we get mixed messages from friends and family that want to share opinions. And I think opinions sometimes come out negative ways. And those negative ways sometimes then bring us back to like, okay, maybe I shouldn't be sharing this anymore. So again, one of the things that I talked about is finding individuals you're comfortable with and really forming support systems for each other. And here's the thing is, just remember this, you are not the only ones dealing with this. We are definitely in a crisis. And again, these crisis situations will probably intensify over the time because again, we haven't been connected. We haven't been connected with a lot of these families. And again, so a lot of things that are happening to them are happening to a lot of other individuals. And really what we want to do is we want to really get a support system together for parents, for youth, for teens that are comfortable in really sharing this experience to bring wellness to each other. So again, it's sometimes just someone that is able to listen and someone just to say, yep, I hear what you're saying. And that's really a lot of what I do with a lot of the men I work with. I'm there to listen. They're there to share. I'm not here to pass judgment. I'm here to help them find the best version of themselves. And I'll keep sharing that, finding the best version of themselves, because again, I think we're doing that daily. I think we're always finding the best version of ourselves. And again, I'll speak for myself. Just because I have all these degrees and lived experience and, worked, 28 years, I'm still trying to find the best version of myself. It never stops. So again, one of the things I could share with individuals before you try looking for that professional help is looking in your surrounding communities, looking in your support systems. And that's really important. Do you have a support system? And what does that support system look like for you? Is that someone that you can rely on? Is that someone that's been helpful in the past? And are these like-minded individuals? Are they there to support you or are they there to put you down? So again, all these things matter and all these things are very crucial when we're really looking for support.
Thank you. And I know, we've talked about just mental health. Can you talk a little bit more about that isolation, feeling, some of us, some of it is normal, right? Like, I mean, we're going through a pandemic and we've been stuck at home, like you've already talked about, right? I haven't been with my friends, with my family. But at what point does it become more worrisome, where, that isolation can lead to something, that none of us want, anybody in our community to see.
Right.
That word isolation, right? Like, I know mental health, and it is definitely connected. So if you can tell us a little bit about isolation alone.
Yeah. So that feeling of alone, feeling abandoned. So isolation, just so everybody knows in the community, isolation is one of the 12 grand challenges in social work throughout the United States. It's a huge epidemic. When we talk about isolation, isolation happens for many reasons. And especially for a lot of our youth of today, around finding their sexuality. And I bring that up because it's a hot topic that nobody wants to talk about. As parents, we are afraid to ask, do you like guys? Do you like girls? Do you not know yet? But what I want to share with that is, because individuals are isolated, they can't share that. And isolation is one of the top reasons why individuals commit suicide, and especially in different communities. Isolation is really you're by yourself. You are alone. You do not feel supported. And so again, I would definitely look at individuals during this time that are always by themselves, are always in their room, are always not wanting to be around somebody. That's really that isolation. And again, what leads to that isolation, if it continues, it can lead further and further down in the depression, where they truly believe there is no hope. They truly believe that there is nobody that's going to help them get out of this place that they're in. And I think with social media, I think that we've been really numb to individuals committing suicide, and we think it's okay. And the fact of the matter, it's not okay. And you should definitely be talking to your family or children about this situation, but isolation. But again, isolation is one of those key things that we want to be able to manage in our families. And again, this is where support systems are really important, because if I had an issue or if there was something available, I would like to ask another parent. Again, I could definitely give you professional suggestions, but again, you want the parents that have the lived experience, who've already raised children. What did that look like then? What does that look like now? But again, really trying to key in your community who's able to do that.
Mm-hmm. Thank you so much. And as we mentioned earlier, and I know Maribel went over the numbers, we are talking to the most hard hit community, right? So this is a focus of our conversations here. Some of us, luckily, we're blessed to have, a bedroom to ourselves, or, a house with an extra room for an office, but not all of us are as fortunate. And so that affects our mental health in itself, right? Like you mentioned, somebody that's experienced in the LGBTQ, somebody can be experiencing just over feeling that sense of like, it must be only me, or even, somebody can be experiencing that they're getting abused and they feel like it's just them, right? I mean, there's so many things financially. I was talking to you, I think the other day, about some of our, some of us that are like maybe about to lose our jobs, don't know if we're going to have a home. I mean, all those things that we feel like it's just me, it's too much. Important. It's so important to reach out. So with that, Michael, I know, and excuse me, Dr. Ybarra, I know that you mentioned, some of the suicides in our community and things like that. I really want to highlight some of our resources in our community right now, in our county that we have. And so after this live stream, we'll post a flyer with this information, but I do want to say it out loud. Our County Behavioral Health Services Department phone number is 1-800-704-0900. And so there, once you call, it will give you several language options, and then it will also give you a list of options in regards to 1, the suicide hotline, 2, the mobile crisis line, 3, urgent mental health services, a referral to mental health or substance use services, and 5, general information. Once again, the number is 1-800-704-0900. And as I mentioned, after our live stream, we're going to be posting some of those numbers. directly. And there you have the number there if you want to jot it down. Important information to have. Maybe we don't need it now, but you just never know when you might need it. And maybe not for yourself, but for somebody that you might know. So thank you, Dr. Ybarra. I'm going to go on to our next question. How can we support each other, especially during this difficult time? When we can't visit one another. Are there any ideas that you have to give somebody in regards to healthy activities that can help them feel better? Any thoughts around that?
Oh, well, yeah. So again, I would definitely really utilize, and again, as we're talking about, use the virtual platforms to really stay in contact with friends and family. I have, and again, 2 of my daughters are in San Diego now. And so again, I have my duo to conversate with them daily if I need to. But again, really call individuals, check in on them. I mean, if we can make change right now today, I would ask everybody that's listening, reach out to 5 people today on the phone and just call them. And if they don't answer, leave them a message just to check in on how they're doing. But again, it's these small things that we don't think matter that matter. It's the smallest thing. It's the smallest piece of compassion that we need to change. And again, that's where a lot of our community runs dry, is we're not compassionate with one another. We've become numb to a lot of our emotions because of where we're at right now. But again, everybody needs a little bit of compassion in their life. It's not about why are you doing this now, but what happened? And we have to ask that, because again, just like you're sharing situations, everyone's situation is different. So again, if there's something that's happening with that individual and they come off different than they were before, just imagine what they're going through. And that's where that compassion starts. And that's where that compassion starts in our communities. Without that compassion, we're just really living in this ugly world where it's okay to point fingers and make fun of and continue the stigmas. But again, a healthy community has compassion and really wants to support one another when they can. And I get everybody has things that they have to deal with in their own families. But again, if we want real change to happen, it really comes from each one of us. And again, it's no cost but time to just reach out to 5 people that you haven't heard of and just, how are you doing? Leave a message. So again, those are some of the things that I would really think about is reaching out that. But some of the other healthy activities, again, I think some of the healthy activities is grocery shopping and cooking a meal together. And again, not mom or dad just cooking, but the entire family cooking. And again, whatever your family makeup is, because again, we have blended families, we have one parent, single families, we have aunts and grandparents, raising children. Like again, whatever your family component is. And again, what I also share with people is family's just not blood. Family's also the best friends you made and really are there supporting you these times. But again, cooking is one, taking a walk. Again, there's things that you have to do that cost no money. It's just taking the time to do that. And again, Karina, one of the things that you did hit on was really finding that space for you. Because again, I know being at home, if you have 10 people in your family, there's probably not a lot of space where you have that alone time. So again, pick a place in your neighborhood, pick a place in the park, pick a place that's comfortable for you where you can get away. But these are really helpful things. But again, there are so many different things you could do that are free. And these are things. And again, you can even do family night watching a movie with multiple families. Like there's technology out there that's free that allows different things to happen so that we can still stay close to one another.
Thank you. And something that we like to do in my family is get on our bikes and just go, and we try a little hill, and we add to that as we go. And so that helps our heart pump and, release some of that stress that we carry. Also, just something that I want to, put out there, as I mentioned, we practice indigenous, culture. Our abuelitas, and our abuelitos, they left this information for us, right? Like I remember my abuelita would be like, this herb is good for, when you're stressed. This herb is good for sleeping if, your mind is just, and so there's the natural connection to Mother Earth as well, right? And so relearning some of those things, calling our aunties, our grandmas, grandpas, asking those questions and having those traditions and cultures relive, right? I know for me, like to have now it's fancy and there's companies that make money with aromatherapy, right? Nothing wrong with that. Some of us go to the store, we buy our, things and we use it in our bathtubs. But our abuelitas were actually our grandmothers would go and harvest some of those herbs and sing to Mother Earth and give her thanks, right? And pour some water so that herb would continue to give to our generations, to come. And so just some of those things that I wanted to share so that, sometimes we have herbs in our community when we take walks that we don't even know are there, but are so helpful. And so just some of those things that if you have those people in your life, call them, and they'll be happy to share. Like, I know my mom still remembers a lot of those things. And so when I ask her, she gets excited and she's, would be like, oh yeah, and, your grandma used to give us this for that. And so it's like, let's keep that going. So just wanted to share some of that. And before we close, move on to any questions around mental health, specifically for you that we might have from the community. Is there anything else that you would like to share with our community that maybe I haven't asked yet, or that you just want to let us know about?
Yeah, no. So I think one is I think you should definitely capture those traditions that happen. And I also would tell everyone also is create new traditions for your family, right? Because again, there's nothing wrong with creating those new traditions as well. And again, I know I won't be able to answer everyone's question, or maybe there's not a question that's going to be able to ask, but you're going to think about it. I am going to be available to answer some of these questions. And again, this is just one of the first, hopefully, conversations I have, because again, there's a lot of individuals out there that are really supporting the community. And so again, this is something to watch for, is that if I don't answer your question today, or if your question doesn't get answered, please continue to ask that question. I want you to be able to know that you are going to be supported. And the other thing is, I am going to be the voice of the community. I didn't get my doctorate in social work just to flag it around. I am going to continue to fight for social justice where it's needed. I am going to make some noise where I think resources should be put. And again, if it starts in the east side of San Jose, then that's where it's going to start. And I'm proud to say that. I did what I did for a reason, and I'm here for a reason. And I just want people to know that your stories and your information you share won't be unnoticed and won't be unheard.
Thank you, Dr. Ybarra. I'm so proud, to know you, to know somebody like you who grew up in the east side of San Jose and is giving back to their community and is paying it forward. I love what you mentioned earlier about, planting those seeds, because I know somebody planted that seed in you, and look at you now. And so, it's kind of the tree that keeps on giving, right? And so
Right.
I'm so happy that you are a part of our community. And I'm going to go to our comments over here and see if there's any specifically for you. I want to make sure, we take that time. Community, I do want you to know that we plan on having these bi-weekly. We're trying to find the time that is best for our community. Again, like I mentioned, we are working with our Mexican, Chicano, Latino, Latinx community. However you identify yourself, we're definitely getting impacted the most, right? And so we want to get these resources out. And also let us know on the comments any topics that you would be interested, in having that you think, would apply to those communities that are getting impacted the most. So we have Rose here, we have Gina, Emily, Henry, Chris, Michael, we have Jana, we have Maru, Pranavan, Surisha, Randy, Hankton, all these community members, thank you for joining us. Jacob. And now I'm going to look for any questions specifically to you. We have Angel. Let's see. I don't know. And we might not have, I know there's several other questions, regarding just, it looks like conversations between people, which is great. We all have the right to, think and ask one another and believe certain things. But I really want to take advantage of our time with Dr. Michael Ybarra, who's very busy and gave his time with us today. Thank you so much for the work you do with our county, with our, like you mentioned, with the women specifically, mothers, who are going through their healing, right? Like you said, we all have our healing to do. And sometimes, as we mentioned earlier, that healing, the generational trauma sometimes just gets passed on to some of us. And so thank you so much, Dr. Michael Ybarra. I know
Yes.
that you and I met many years ago at San Jose State, and I'm so happy to be sharing, like you said, this forum here with you, knowing that we are here to continue to serve our community, to continue to do what we need to do in order to have a healthier world, right, for ourselves, for our children, and generations to come. Rudy sent a shout out to you. He says, "Boy Wonder." So thank you so much for joining us. Any specific questions, please? We have a few more minutes here. Take advantage.
I have one question. So as a community, we hear of the fears of our people taking the COVID-19 vaccine. Can you share any insight on how we can help our community get through those fears? So one of the things that I've shared with people to do is take a picture of you getting the vaccination, the 1 and the 2, and share it and post it. I think what's happened a lot in social media is we hear about the one tragedy out of the 100,000 individuals that have taken the vaccine successfully. Take those pictures, post it on your social media if you can, to really let the community know that it's safe. I've already got the first vaccine. I take the second one on Monday. I didn't experience anything at all. And again, I really want to support our communities, get this crisis down. So again, one of the things I share with folks is if you can take a picture when you're taking the COVID and post it to share with others, that's a great way of letting people know that it's safe.
Thank you. Great idea. And I like how you called people to, just get on their phone and make phone calls. Maybe let's start with our elders, right, too. And, maybe it is that they need support with making an appointment online or getting a ride to these places. It could be pretty intimidating for any, adult. Now I can imagine being an elder and wondering if you're going to stand in the line or things like that. So along with the phone calls that Dr. Ybarra is calling you out to do, I would say, if you can do at least one thing for an elder in your life, whether it's a neighbor, whether it's a family member, to help them get an appointment and get their vaccine. As we know, it's 65 and older in our county. So we're able to do that. So and when we do something good, right, Dr. Ybarra? It does something for our mental health.
It does. Basically, that's part of, and again, this is the recovery, but it's for everybody. Helping someone else helps you inside more than you actually know. And it's the small things that you could think of that we think are typical, but no. Opening the door for someone, saying hi to somebody, smiling. Like, again, these are all things that don't cost anything. It's the change of your mentality. It's how you approach life. Again, this is the small things that we can do to change our community. And again, we're looking for wellness for everybody, not just a few folks. It's for everybody. So again, these small things that you can do really make a difference. So again, just putting that out there. And then I have a little group that's on Facebook right now. So it's I want to shout that out real quick, because again, I am looking for positive stories, positive conversations, positive things people are doing in the community, because again, we hear too much of the negativity all over social media. So again, I'm proud to be from I'm hella proud to be from San Jose, and I want positive change. It's a group out there. Again, please add yourself to it. I'll be sharing the next time I'll be presenting or having a guest speaker on. But again, these are ways to change our community with positive stories, because again, we already hear all the negative things that are happening. But again, it's that change of our mindsets.
Thank you. And Dr. Ybarra, when we're done, if you can put that in the comments so that some of us who maybe didn't write it down can make sure. I know I'm a part of the group already, so yes. I'm good. But for those who might want to jot it down and be a part of it, we'll make sure to get it into the comments to make sure that people sign up if they're interested.
Definitely.
Thank you so much. And any other questions? Let's see. We do have one from America Pinal, and she's saying, "Thank you for this community service, Dr. Ybarra. Please, can you provide direct resources for teens dealing with depression?"
So I don't have the direct contact, but I think there is a teen hotline. And that's the one I would definitely call to start that service. And I know for sure that Santa Clara County has also started a young adult or teen program. I don't know if it's still live and active due to the pandemic, but again, I want to make sure that we definitely address America's question, because again, I think it's important. And if that's not a resource that supports you, we definitely would want to know about that too, because we want to help you find what's going to work for you. And then I see any tips for students losing motivation with online school. Gosh, I think that's a separate question that would definitely be addressed with a lot of our teachers. But one of the things I can share is doing things in steps, and setting up goals, like attaining goals. And when they get a goal, a reward. That's just some of the things that you might want to just do right now during this pandemic. But again, you also want to know what's happening online with school, because I know a lot of times the instructors are there and they have an outline. And again, for some of our teachers, it's been a challenge too to do online work. Again, this hasn't been easy for anybody. So again, just some of the tips is really doing short goals and really breaking things down so it's not one huge assignment. I know for my son who has ADHD, when we were impacted with all this work and it was a big page with just a bunch of words, we had to break it down so that he wouldn't be so impacted and overwhelmed with the visual. And it is a visual concept, right? But if you break down each piece of the work little at a time, it doesn't feel like it's a whole bunch of work. So again, this just something to strategize as a tip.
Thank you so much. And we are coming to the end of our hour here with you. I want to respect your time and thank you so much. Any closing words, Dr. Ybarra, before we close? We have here from Teresa Villarreal Vasquez. Awesome work you're putting in, Mike. And it is. Thank you so much for the work you're doing with our community.
Yeah, I'm just really excited. And again, I just want to, for those of individuals really seeking to want to help and be in this field, gosh, it's not too late. And again, we're looking for support. And just one statistic I want to share, in the United States, by 2025, we'll be 250,000 mental health workers short. That is huge. And so again, I'm bringing that out there to let you know that we are seeking a helping community. We are seeking individuals into this profession, knowing that this pandemic is going to create a lot of things once we get back into stuff. And people are still going to be dealing with depression and anxiety, financial burdens, all these different situations that not only were happening pre-pandemic, but now post-pandemic, with not working, not having resources. All these things have been impacted. So again, this is a conversation that continue and will still need to happen.
Thank you so much for your time. And I really want to highlight the fact that, we see somebody that looks like us, that, looks like my brother, that looks, it does something. So not just any social worker, right? But like the fact that you're there helping out our community that looks like you, that talks like you, that walks like you, does that much more in the healing of our community. So thank you so much for that. Thank you for taking that journey, which wasn't easy. I'm sure. I don't have my doctorate and it's, scary. Like not all of us are brave enough, and you were. So thank you for doing that for our community on behalf of you and those you represent and all of us as well. With this, I'd like to close, and we look forward to seeing you in a couple weeks on another forum. Thank you again, Dr. Ybarra, and thank you, community. We'll see you again.
Thank you so much, everybody.